how much ever I push from inside, still going to be a little bit bulbous.
Tip is quite droopy, does not have septal support.
We're going to be correcting that double chin. That chin has become more prominent, virtually not existing.
Given him a straight dorsum with a sharp tip.
Thick, how much ever I push from inside, still going to be a little bit bulbous. But it's still going to be way better because now this is arcing for you.
This is bent.
वो सब straight हो जाएगा. It'll get stretched.
और यहाँ से दिखता हूँ ना.
That also will get stretched. All of that will get it stretched. It won't be feminine. Don't worry about it.
Okay. And ये जैसे हम ये देख रहे हैं ना, जैसे सीधा चिन. अब ये क्या है कि थोड़ा सा और लंबा हो गया ना, तो जैसे 1 mm 2 mm हो गया तो आइडियली ठीक है.
मैं 2 mm ही लिख दिया आपके लिए, ज़्यादा नहीं करूँगा. मैं समझ गया आपका पॉइंट.
अगर वो ज़्यादा हो जाएगा ना तो फेस बहुत मेरा लॉन्ग लगेगा.
ठीक है. 2 mm horizontal 6 to 8. Done. And it will all be measured. And if you want, we can show you in the video also. क्या एग्जैक्टली हो रहा है ताकि आप डाउट में ना हो जाए. क्योंकि काफ़ी पेशेंट्स का क्या होता है, सर्जरी के बाद क्या होता है, सूजन हो जाती है. फिर आके बोलेंगे डॉक्टर साहब आपने ज़्यादा कर दी. तो मैं बोलूँगा नहीं डॉक्टर ज़्यादा नहीं किया, मैं आपको प्रूफ पीछे दिखा सकता हूँ. बट इफ़ यू विलिंग फॉर वीडियोस, वो भी निकाल के आपको दिखा देंगे कि जो हो रहा है वहाँ पे वो भी आपको मिल जाएगा. तो यू आर एट पीस. अदरवाइज एनीवे विल टेक अ स्कैन फ्यू डेज आफ्टर सर्जरी. सो ठीक है. दैट्स व्हाई आई एम मेकिंग प्रिसाइज नोट्स ऑन दीज पॉइंट्स दैट यू आर गिविंग.
ओके. एंड सर ये जब हम चिन का करेंगे, this will look defined
better than now.
Better than now.
Absolutely.
Like I'll show you this pic. Actually 4 months pic, right? So I'll show this 45-degree angle. See, like this, you know, this is 45-degree angle. So this line is appearing.
It will be much better than this.
Much better than this, right?
Why? Because we're going to stretch the muscles that are attached to the part of the jaw bones, right? So that will define your jawline. That's why when we do genioplasty, when we do jaw sculpting or whatever, along with that, you always get a better jawline. Every single patient will get a better jawline. It's like a reverse facelift effect. Skin also gets tightened. So you start to look younger, you start to look like the skin is tighter. Everything happens, part of it. Double chin reduces. This all is added to the whole thing. It just happens.
Okay. And sir, one last thing about anesthesia. I have a huge anxiety about it. So my anxiety is.
You don't have to be anxious. Just relax. What is it?
My
anesthesia.
Anxiety is that, you know, I have read like in rarest of rarest complications, some lung deflation can happen.
Many things can happen. If you look at, like you're taking a flight now, 110 things can go wrong.
Yeah.
You don't think about what can go wrong when you're in safe hands, right? It's like that. So we have a separate group of team who will take care of your anesthesiology and its concerns. First of all, there is something called as ASA grade 1, grade 2, grade 3, grade 4. इसका मतलब क्या होता है? ASA 1 means no risk, 2 higher, 3 higher, like that. So if the risk is high, we will not do surgery for you, even if you want it. Okay, that's the first way to know safety is there. Secondly, because we have a team of anesthesiologists and an anesthesiology technician, so they are very capable in taking care of this. Every day they're doing day in and day out. So procedure पे चलता है. अब आपका बीपी कितना है, ये कितना है, एको कर दिया है क्या, ECG हुआ है क्या. जब आप फिट हैं, जब आपके लिए सब कुछ नॉर्मल है, तो ऑलरेडी रिस्क next to 1 in 10 million ऐसा कुछ हो जाता है.
I understand.
So that is what, no, I'm telling you this so that you relax.
Okay.
Anxiety is not a good thing before surgery. Everyone is little bit anxious. This is common human nature. But you don't have to fear that कुछ हो जाएगा, ऐसा कुछ होने नहीं वाला है. अगर हम लोग सर्जरी के लिए करेंगे तो आपको ऐसा कोई दर्द भी नहीं होगा, ऐसा कुछ इवेंचुअलिटी भी नहीं होने वाला है.
Okay. So sir, how long will I have to stay here?
1 हफ्ता.
Minimum.
Yes.
Okay. Is it possible कि after 2 days I can stay at hotel?
Sure.
That is possible.
Possible for you, mostly. But I'll tell you after 2 days. Suppose you want to do extra days, you have to stay here.
Yeah, that is fine.
Possible.
I have taken a hotel room here.
You can vacate now. Why would you want to pay first 2-3 days? You can't stay in the hotel first 2-3 days.
Yeah, that's fine.
Ah.
Yeah, but then I'm not sure whether I will get the room again.
No, you will get it.
Get it.
Otherwise, manager, somebody will get it for you.
Okay. Yeah, help is there.
They'll
Food
organize.
wise is I have to.
Food wise, initially you'll be on liquid diet for a day or two, which we will be able to help you
Arrange.
from here.
Okay.
After that, you are able to use your Swiggy or whatever you want. They'll help you with the food, not a problem.
And sir, एक चीज मैं पूछना था, after the surgery, how long will it take to feel like right I'm feeling right now?
6 months.
6 months. Okay.
Especially nose in your case will take longer. Nose might take 4 to 6 months. Chin might take 1 to 3 months.
So like if I have to sneeze,
You can. What will happen?
It will pain, right?
No, it won't pain. Pain all will be enough. Will be over within a week. For sneezing and all, we'll give you medications when you're going. Nothing to worry about such issues.
Okay. So
ठीक है?
you will what you do like mock surgery and this?
No, I will not do mock surgery because mock surgery is actually doing the surgery on your models here.
Okay.
So that for a bi-jaw or for a major jaw surgery I would do, but in your case I would not do.
Okay.
And you have very clearly told me what you desire. So what I have to do is now simple. I'll have to check where the nerve is, where the teeth is, if anything is abnormal, that's all. And then plan and take you to the surgery.
Okay.
ठीक है?
This wisdom tooth is not a problem, right?
नहीं, let it remain. Unwanted things will not do. ठीक है, इनका ready कराओ. You want me to try and plan surgery for you early tomorrow, or when would you want me to do it?
At the earliest.
Yeah, at the earliest. So I think
8:30 a.m. today I took some water.
Good.
She told me ki.
Yeah, no. What we'll do is, see, I have a couple of surgeries scheduled for the day.
Okay.
It's anyway going to take me till maybe 6 or 7.
You see,
So let's finish your basic workup.
yeah.
That will take an hour. You see the anesthesiologist also. तब तक they'll give you information कि आज हो जाएगा या कल. जल्दी नहीं करेंगे.
I want you to be relaxed.
Yeah. That's
I
what.
don't
So
want कि बहुत काम करने के बाद I want you to be relaxed. So take your day.
तो फिर ऐसा कल ही better रहेगा.
कल better. It's
कल तो you also can rest the whole day.
okay.
And so what we can do is पूरा investigations करा के ना आप चले जाइए, अच्छी तरह से रेस्ट करो होटल में, सवेरे कल आ जाओ without having breakfast. तो आपका फर्स्ट हो जाएगा. जल्दी स्टार्ट करेंगे 10 बजे तक. चलो क्या
So here we are with yet another patient who has come for two major surgical procedures. One is for the nose and the other for the chin, a rhinoplasty. Purely a cosmetic rhinoplasty. He does not have any functional issues, but he has many specifications. One is that he wants a sharp tip. His tip is quite droopy, does not have septal support. Also, his alar base is flared. We can see the nostril show even in the frontal view. Secondly, for the chin, he has a short and retruded chin. Can you look to your side? Yeah. So, but since his facial profile is already long, we are not going to do a lot of vertical augmentation, more in the horizontal, less, very minimal in the vertical dimension. This is going to require 2 intubations, one nasal and one oral. First we'll start with the genioplasty and then change the intubation. So the overall procedure time would be about 4 hours, and he will be staying with us for another 5 days, and or maybe 8 days max. And for the genioplasty, he does not need to worry about any suture removal because all the sutures are going to be placed inside the mouth. And for the nose, they will be removed on day 7 or day 8.
We're about to start this genioplasty, chin augmentation. We're going to be correcting that double chin that he has. We're going to be giving him a little bit more male, strong personality by improving the proportion of his chin. It's not a major movement we're planning. We're planning moderate movement, 6 to 8 millimeters horizontally and 1 to 2 millimeters only in the vertical dimension. And this is going to be a bony jaw surgery. Okay.
chin augmentation, you can see how the patient's double chin has totally disappeared. The chin has become more prominent, more proportional, jawline has become much more defined. We're going to show you how he was before. Look at that. So the mental-able grooving of fold has been increased, and this is just moderate movement as I showed earlier. 6 millimeters horizontal augmentation, 2 millimeters vertical augmentation. We're going to show you the same difference now when you see in the front view. So you see it's not a major change. There's still a subtle minor improvement to the contour of the chin and to the tightness of the skin around the region. Okay. With this cosmetic reconstructive augmentative nose job, nose recontouring surgery, now we're going to show you how he looked before we started in the same view. So you can see the improvement. So the nose didn't have adequate support at all. The dorsum was, as you can see, overhanging, a small hump. Tip was virtually not existing. The angle of the columella was more than 110 degrees, so we've corrected all of that. Now we're going to show you the front view. So again, you can see the improvement. So that's the basal view. You can look at the improvement in the tip to support the relation between the columella and the alar base. Yeah.
All right, so we are 10 days post-op, just removed the splint for the nose, and this is for the chin here. It's going to be a little painful. So we've done a rhinoplasty and a genioplasty. Just show you the pre-op so that we can compare. Alright, so now we will be showing all the views one by one, starting with the basal view. Thoda आप ऊपर देखें. So you see from this view you can see a triangular kind of a nose which is elevated on the dorsum. He has a hump which is clearly seen. Doesn't have a tip or any projection at the tip. We've given him a tip now and a smooth curve. Next, coming to the side view, just look to the side. Yeah, sister, inge konja. Yeah. So you see, there was a very uneven dorsum that he had, We've given him a straight dorsum with a sharp tip. He lacked a tip projection, and the nostril show is very much visible from the frontal view itself. But now his nostril is below where it should be and it's not seen from the front. Again, this side. We'll go to the frontal view now. Yeah. So from this view, we can see that we've given a curvature on the dorsum, augmented the right from the radix till the tip, also done alar plasty both sides, and given him a tip projection. There is some amount of swelling here and this region, but will settle down on its own. So that was about the nose. Moving on to the chin. Yeah. You look to your side. So he was very specific about the augmentation because he had a long face. He did not want much of vertical augmentation, more of horizontal, but that also very minimal. We have not done a proper like how we do a 10 mm or 12, 14 mm augmentation in patients. He wanted minimal augmentation on the horizontal and the vertical dimension. So it is a genioplasty done 2 mm in the vertical dimension and about 6 mm in the horizontal dimension. So we'll be able to appreciate this more on the scans because as such you will see minimal improvement when it comes to the chin, but when we see his overall facial proportion, it is what suits his face. And are you happy with your results?
Yeah, very happy. Just wanted to ask, that yes, nose has come out really well.
Yeah.
And much better. Just wanted to ask that, this is like a bit of curvature sign kind of something?
Yeah.
Or
Yeah, it is a curve,
okay.
but that is because if we augment it too much, then it'll look, it won't suit your face because you have a slimmer profile, like more on the slimmer side.
Yeah.
We don't want to give you a very big nose and make that very prominent.
Okay. And the other thing is that with this genioplasty thing, right? So has the face become little chiseled kind of thing? Does that happen with the advancement genioplasty?
Chiseled meaning?
Not chiseled, matlab, like this. I feel like this has become a little prominent now. This cheekbone.
Cheekbone? No.
Not prominent.
No. Probably it's just the swelling is very uneven at this point on your all over your face.
Yeah.
So you can't comment on this bone becoming prominent.
Okay. Tommy was done here.
Yeah, on the lower part of the chin, the lower
part.
segment. I'll show you on the scan.
Okay. Yeah. It's good.